Hi, I'm Dr. Phoebe King with Texas IPS. I look forward to meeting you and starting our patient-physician relationship. I hope you stop by. I did medical school at St. Louis University, and then I came to Texas to do my residency here at University of Texas Health Science Center in San Antonio. I also did a chief resident year and fellowship at the same institution as well. Being a pulmonologist and an intensivist provides a unique standpoint, and it provides a unique way for us to build a patient relationship. Oftentimes in clinic, we'll see patients that are not as sick, they have more chronic illnesses, and we work on improving their health care and maintaining their health. And that allows a more longitudinal relationship where we see patients every 3 to 6 months. And it's very personally rewarding for me because I can see a patient who can come in and they can't walk across the room because they're so short of breath because of their COPD. But you put them on a good medication regimen, you get them maybe through pulmonary rehab, and suddenly they can go from not being able to walk across the room to being able to walk across or walk on a treadmill for 10 minutes, which is life-changing for them. And I think that's it's what helps me get up every day and helps me come to work, and it helps me obtain personal satisfaction from my job. And then as an intensivist, I think obviously the patient-physician relationship is extremely important because these patients are very ill and they need someone to come in, and oftentimes they have life-threatening illnesses. And it's kind of unique because as an intensivist, sometimes that actual relationship almost takes a back seat in that the patient, sometimes they can't speak with us because they're on a ventilator. And then your relationship shifts from a patient-physician relationship to a relationship with the family members. And that is extremely important. And I always try to keep in mind that I want to treat this patient like I would want my loved ones to be treated. And then I imagine myself as the patient's family. And I always treat my patient's family how I would want myself to be treated, or my parents who, don't have a medical background and they don't understand the complex medical issues, so I always be sure to explain it in a very, in a way that's easy to understand. So I think without a patient-physician relationship, there is no relationship and there is no way for the patient to get better. So I think it's of vital importance. So the reason I became a physician was an episode that happened to me when I was a teenager. At the age of 16, my grandmother became very ill. She developed an infection in the fluid surrounding her spinal cord and her brain. She was in the ICU. She was very sick. It was a very life-changing experience for me. It was amazing the way her physicians knew how to take care of her, the care that the nurses provided for her. It was just incredible to me. And fortunately, she had a full recovery and she went on. She had other health issues along the way, but she recovered from that incident. And to me, it was just amazing. And I thought, if only I could do that, if only I could be like those physicians and be like those nurses and provide future patients with that level of care, and to be able to impact not only the patients but their families, and to be able to take someone who's deathly ill and whose life is in danger and to turn that around, it just seemed like such an incredible feat to me. And so from that day forward, I decided I was going to be a doctor. I started out my life and I always thought I was going to be a lawyer, and I turned over to the bright side, turned over to the good side of things.